We are a multidisciplinary clinic. We cater for many people, but we've got sports physicians, we've got physios, podiatrists, massage therapists. We have a lot of really expert clinicians in life performance, and one of our mantras, part of our ethos, is the elite to every day. So when we're treating our patients, we see we have our clinicians who work in elite sport, and they bring that high performance mindset back to treat our patients who are everyday patients. Might be weekend warriors playing sport, and might be everyday people who want to run around with their grandkids. We see people who at both ends of the spectrum there. We are very data driven in the way we operate, so we have all the latest technology to be able to produce accurate data that can then help us frame decisions based on where the patient is at, to be able to progress their rehab and get them through criteria-based progressions towards the final outcome, whatever that patient wants to get back to. And that leads to outcomes. We are outcomes focused. We don't just see people have a treatment session, give them some exercises, they disappear. We work with the patient until that final outcome is achieved. And every clinician really prides themselves on achieving outcomes for patients. We've seen the explosion of the tech space over the last 10 years. When I first started, it was a lot of guesswork. It was looking at a person, you look better, they feel better, right, you're good to go back and get back to work, or get back and climb the stairs pain-free, or get back to the field of sport. But now we have the ability to assign numbers to this, to ensure that we aren't pushing people to a point that they can't tolerate, they get re-injured or they injure something else. We're very structured on the way we can progress people, and it's just it's a credit to the technology that is available now. It's a completely different environment. Even from when I started in the mid-2000s, it was very secluded in your treatment room, it was hands-on therapy, and then there's this sort of shift towards the strength and conditioning model, and a lot of physios now, they come with training in strength and conditioning as well as their physio. They may have done a degree in strength and conditioning and they won't go into physio. So I've definitely evolved in that direction. It's been a fantastic thing for the athletic environment because just rubbing a knee and getting some massage is not going to prepare that athlete to go and withstand the forces that we're going to see on the knee that occur during a jump and land, during a change of direction. So the closer we can mimic those field-based actions and those high-risk actions that we know that occur with ACLs, with shoulder dislocations, the more we can build our patients up to that level and expose them to that level of training, the safer they're going to be on return to play and less risk of recurrent injury. A couple of years ago, when we got together as business owners and thought, where do we want this business to go? What's the vision? Life Performance kept coming up for us. It's a simple name, but it really encapsulates who we are. There's one arm where it's the athletic endeavours, but there's also the people who are 50 plus, and we know with age that bones deteriorate, muscle deteriorates, part of being human. Postmenopausal women maybe more so. So this cohort of people we see a lot, and we have an environment where it's not a gym, it's supervised by physios, and it's evidence-based, evidence-led programs that we run in here called Bones and Brawn, and people come in, they feel comfortable, they get benefit out of it. We've got the metrics to test they're improving, and we've got the sports physician, the dietitian, to actually make it this whole holistic approach towards improving bone health as they age. So that is probably the other big facet of the Life Performance way. I was introduced to Skin and Bone probably only 3 months ago, and had numerous discussions, and we really aligned on a lot of our philosophies and on the way the body works and the way rehab should be structured, and the fact that there are so many injuries we're seeing that don't necessarily need surgical input straight away. There's plenty of research saying that, and I think the fact that Skin and Bone has got on the front foot there and fostered this new way of doing things, I think is fantastic, and makes sense based off the evidence. So we're thrilled to be on board with that and be aligned with Skin and Bone, and can provide so much value to people to be able to get them back to doing the things that they love to do. We have patients still who, they may have overlooked or they've pushed through an injury, and we see them say at 3 or 4 months they've been battling with this problem. The issue there lies in the fact that that early stage we know that it's critical for tissue to heal. If you have an acute injury, that tissue's got to heal, and it's got to heal optimally. If you have, say, an Achilles tear and you let it go and you don't rehab it properly, you end up with this suboptimal tissue development, like scar tissue, and it can lead to long-term problems. An Achilles injury could last for 1 to 2 years. If we get it early, we optimise the environment for the healing tissue at the start. We give them the guidelines on do this, don't do this, and then we can get stuck into the physical rehab with the tissue and the musculoskeletal system around it. Then we're going to give that patient the best possible rehab process and the best possible outcome. The sooner we can see you, the most acute injury, if it's, we can get you moving towards getting better straight away. And if you procrastinate and sit on it, it's going to take you that much longer on the back end.